Did you know that diabetes isn't just about sugar levels? It's actually about something deeper, the nutrients your body desperately needs but isn't getting. What if the key to feeling better isn't just managing sugar, but restoring missing vitamins? Imagine what could happen if you could boost your energy, calm those restless nerves, and finally get your blood sugar back in balance. Without feeling like you're just managing symptoms? Here's the truth. When you're low on the right nutrients, your body quietly falls out of sync. But most of us don't even know it. The worst part? These deficiencies are slowly making things worse without us realizing. But here's the good news. It doesn't have to stay that way. Today, we're going to reveal 3 vitamins that could change everything for you. You'll learn how to spot the signs of a deficiency and, more importantly, how to get these vitamins in a way that actually works for your body. Curious? Let's dive in and uncover how small changes could make a huge impact on your health. Let's start with a big one. Vitamin B1. It also known as thiamine. You ever feel constantly tired, even after a full night's rest? Or struggle with brain fog that makes even basic tasks feel overwhelming? Maybe you've brushed off tingling or numbness in your feet as just the diabetes. But what if it's not just the sugar? Over 3/4 of people with diabetes have low levels of thiamine, and many don't even know it. Why? Because high blood sugar causes your body to flush thiamine out through your urine. Add in inflammation, poor gut absorption, and medications like metformin or diuretics, and thiamine gets drained faster than your body can use it. And while the first signs, like fatigue, anxiety, memory issues, and muscle weakness, can feel subtle or even normal, they're your body whispering for help. Let it go on too long, and the signs get louder. Blurry vision, shortness of breath, numbness in your hands or feet, balance issues, nerve pain that just won't calm down. These aren't minor annoyances, they're clues. If you want to know for sure, you'll need to ask for specific labs like whole blood thiamine, TPP, thiamine pyrophosphate, erythrocyte transcatolase activity. These tests aren't usually part of standard diabetes panels, which is why thiamine deficiency often gets missed until the damage is well underway. So what does thiamine actually do? It's a coenzyme that helps your body turn sugar into usable energy right inside the mitochondria, your body's powerhouses. Without enough, glucose can't be broken down efficiently. Instead, toxic byproducts like lactic acid and AGEs, advanced glycation end products, start to build up, damaging nerves, vessels, and kidneys over time. And here's where it gets personal. Low B1 hits your brain first. Thiamine is crucial for creating acetylcholine, a neurotransmitter that fuels memory, attention, and focus. Deficiency has been linked to higher rates of depression and anxiety, especially in diabetics. It also affects your metabolism, slows fat burning, and worsens insulin resistance, making it harder to lose weight, especially belly fat. For both men and women, thiamine is key for fertility and hormone production. When you're running low, testosterone and estrogen levels can drop, leading to lower libido and reproductive issues. In your eyes, low thiamine weakens the tiny vessels that supply your retina, speeding up vision loss. In your nerves, it slows signal transmission, making pain, numbness, and tingling more severe. In your kidneys, low B1 worsens protein leakage and speeds up nephropathy. In fact, studies have shown that thiamine supplements can reduce early kidney damage by up to 40%. So, where can you get thiamine from real food? Here are some of the best sources. Pork loin, 3 ounces, 0.8 milligrams, 67% of your daily needs. Sunflower seeds, a quarter cup, 0.4 milligrams. Trout, 3 ounces, 0.4 milligrams. Black beans, half a cup, 0.2 milligrams. Beef liver, 3 ounces, 0.3 milligrams. These foods are nutrient-packed and naturally low in carbs, perfect for blood sugar balance. You can get creative with meals like garlic rosemary pork loin with sautéed spinach, trout fillet with a sunflower seed crust, or a black bean and liver pate spread over roasted eggplant. Every bite in these meals is designed to nourish your nerves, energize your cells, and support your metabolism. Thiamine is stable in gentle cooking, but it leaches into boiling water. So avoid tossing out the liquid from beans or meats. Pair your meals with magnesium-rich foods like leafy greens or seeds to improve absorption. Just a heads up, alcohol, high sugar intake, coffee, and processed foods all burn through your thiamine stores faster. Even raw fish and excessive tea tannins can interfere. If you're looking into supplements, the two best forms for people with diabetes are benfotiamine, a fat-soluble version that's easily absorbed and supports nerve and kidney health. A lithiamine, derived from garlic, great for brain and energy support. Doses usually range from 150 to 300 milligrams per day, taken with meals. Most good quality brands fall between $15 to $30 per bottle. Feeling wiped out, mentally drained, or nerve pain that just doesn't match your blood sugar. This might be the missing piece. Restoring your thiamine isn't just about fixing a number. It's about waking up your body from the inside out. Now let's talk about something that often hides in plain sight. Vitamin B9. Ever wake up and just feel flat? Your brain feels slow, your energy's missing, and your body just doesn't move the way it used to, even when your sugar's in check. It's not laziness. It might be low vitamin B9 or folate, and if you're diabetic, that's more common than you think. In fact, over 40% of diabetics have low folate. If you're taking metformin or have any kidney complications, that number climbs even higher. Here's where it gets tricky. Low folate symptoms often look exactly like regular diabetes: fatigue, mood swings, foggy thinking, tingling in your feet, slower healing, even changes in weight. So it's easy to miss, but inside, the damage keeps building. As folate drops further, things get worse. You might notice mouth sores, dizziness, pale skin, numb hands or feet, and worsening neuropathy. One major clue? Elevated homocysteine levels. That's a toxic byproduct your body struggles to clear without enough folate, and it can harm your blood vessels, nerves, and kidneys over time. Folate is essential for making neurotransmitters like dopamine and serotonin. So when levels are low, it's not just your body that slows down, your drive, focus, and mood take a serious hit. On a deeper level, B9 plays a role in DNA repair, cell division, and even insulin function. When you're low, your body can't detox properly or burn fat efficiently. It creates a perfect storm for weight gain, brain fog, and insulin resistance. And get this, low folate can even affect fertility in both men and women. It supports sperm formation, egg health, and hormone balance. Deficiency can lower testosterone and estrogen, and increase infertility risks by up to 30%. In the eyes, low B9 restricts blood flow and worsens diabetic vision problems. In the nerves, it delays healing. In the kidneys, it pushes damage further. All silently, if left unchecked. Best tests are serum folate, RBC folate, homocysteine levels, especially important. If folate is low, it's time to take action. Forget synthetic folic acid. The real magic comes from real food. Beef liver, 3 ounces, equals 215 micrograms, 50% daily needs. Asparagus, half a cup, cooked, equals 135 micrograms. Spinach, half a cup, cooked, equals 130 micrograms. Avocado, 1/2 piece, equals 80 micrograms. Lentils, half a cup, cooked, equals 180 micrograms, 45%. These foods are diabetic friendly and won't spike your sugar. Combine them with protein or healthy fats for better absorption and smoother blood sugar response. Try seared beef liver with garlic butter and wilted spinach. Oh, or a creamy asparagus avocado soup. A Mediterranean lentil salad with feta, herbs, And olive oil checks the flavor and nutrition boxes. These meals don't just taste amazing, they actively nourish, repair, and energize your body from the inside out. Folate is water-soluble and heat-sensitive. Boiling can destroy up to half of it. So go for steaming, light sautéing, or raw options like avocado and fresh herbs when possible. Pair folate-rich meals with vitamin C, B6, and zinc for extra benefit. And watch out for alcohol, smoking, and processed foods, which quickly deplete your levels. Also, some nutrients and additives, like unsoaked legumes, phytic acid, or excess calcium from dairy, can block absorption. What about supplements? If you're supplementing, choose methylfolate, 5-MTHF, not folic acid. Methylfolate is the form your body uses directly, and up to half of people have gene variations like MTHFR that make folic acid less effective. A safe daily range, 400 to 800 micrograms, ideally with food in the morning and paired with B12 and B6 for best results. Avoid synthetic folic acid unless prescribed. It can build up and do more harm than good, especially in people with insulin resistance or MTHFR issues. Feeling foggy, low on energy, or like your nerve pain keeps creeping in, even when your sugars look fine. Folate isn't just a nice to have, it's a foundation for better energy, sharper thinking, and stronger nerve health. And fixing it could change your day, your week, and even your long-term health. Let's talk about a mineral that doesn't get enough credit, yet it quietly controls over 300 vital reactions in your body is magnesium. When you're diabetic, magnesium becomes even more important. It's directly linked to how fast your kidneys decline, how well your insulin works, and even how you sleep at night. But here's the twist. Most people with type 2 diabetes are low in magnesium and don't even know it. This deficiency often hides in plain sight. Restless sleep, random muscle twitches, sugar cravings, anxiety, tension headaches. These aren't random symptoms. They're clues. And when left untreated, they can progress into more serious issues: high blood pressure, irregular heartbeats, insulin resistance, mood swings, and nerve pain that feels deeper than just the surface. Most blood tests don't tell the whole story either. Serum magnesium only reflects a tiny portion of what's really going on. If you really want to know where you stand, ask for an RBC, magnesium or magnesium loading test. These give you a better view of your actual magnesium levels inside, the cells where it matters most. Why do diabetics lose magnesium? Every time your blood sugar rises, your kidneys flush out more magnesium. Add inflammation, insulin resistance, diuretics, or acid blockers into the mix, and magnesium gets drained faster than your body can replace it. But here's why it matters. Without enough magnesium, insulin can't do its job. It struggles to bind to its receptor, which only makes blood sugar harder to manage and creates a vicious cycle. Magnesium also supports serotonin and dopamine production, helps regulate hunger, boosts metabolism, and directly impacts how your body handles glucose. Just a slight increase in magnesium intake has been shown to reduce fasting blood sugar by 10 to 20 milligrams per deciliter. And that's just the beginning. Top diabetic-friendly magnesium foods. Here are 5 powerful, blood sugar-friendly magnesium sources. Pumpkin seeds, 1 ounce, 168 milligrams, 40% daily needs. Spinach, half a cup, cooked, 78 milligrams. Almonds, 1 ounce, 80 milligrams. Avocado, 1 medium, 58 milligrams. Black beans, half a cup, cooked, 60 milligrams. These foods are naturally low in sugar, high in fiber, and easy to build into balanced meals. Need inspiration? A pumpkin seed and almond-crusted trout, pan-seared with garlic and olive oil, gives you a solid 300 milligrams of magnesium, plus protein and omega-3s. A fresh spinach avocado salad with tahini lime dressing and roasted seeds adds 250 milligrams of magnesium and anti-inflammatory fats. A hearty black bean and quinoa. Stew with herbs and lemon. Zest offers around 200 milligrams. Perfect for warming your body and calming your nerves. Smart cooking and supplement tips. Magnesium is water-soluble and a little sensitive to heat. So lightly steaming or sautéing your veggies helps preserve more of it. Pairing magnesium-rich meals with vitamin B6, found in foods like turkey or chickpeas, boosts absorption, while high-fiber foods like raw bran or unsoaked legumes can actually block it. Also, caffeine, sugar, alcohol, and even stress can flush magnesium out of your system, even after a healthy meal. That's why regular, mindful replenishment is key. Looking into supplements? The best forms for people with diabetes are magnesium glycinate, magnesium citrate, magnesium malate. They absorb well and are gentle on digestion. Avoid magnesium oxide, which is poorly absorbed and acts more like a laxative than a real fix. Typical dosage ranges between 200 to 400 milligrams per day, depending on your needs. It's best taken with food in the evening, when it can help with sleep, nerve repair, and recovery. Always check the label for elemental magnesium and choose a third-party tested brand for purity. Most quality options cost around $10 to $25 per bottle. A final word on healing with nutrients. If your blood sugar seems okay on paper, but something still feels off, if your nerves are acting up, your energy's flat, or your sleep is restless, magnesium could be the missing piece. It doesn't just manage symptoms. It helps you feel whole again. When you bring your magnesium back into balance, everything else, blood sugar, sleep, mood, nerve pain, starts aligning. One quiet shift at a time. This isn't just about vitamins. It's about taking your body back with food, with understanding, and with care. If this helped, give it a like. Share it with someone who might be feeling the same. Drop your questions in the comments. I read each one. And don't forget to subscribe for more easy to digest health wisdom. That truly makes a difference.